Yeah, so Rebecca's here just in case we have any technical issues, if they may arise. Also, if you have any questions throughout the presentation, please feel free to go ahead and enter it in the chat box. Just to let you know, I might answer some of the answers along the way, but we'll definitely have time for Q&A at the end of the presentation. All right, so hi everyone. Thank you so much for joining today with me on this webinar. I'm going to talk to you guys about Diastasis Recti abdominis. So just right off the bat, just to introduce myself a little bit, my name is Anissa Akrut. I'm a physical therapist. I received my doctorate from the University of St. Augustine back in 2015. I have worked a little bit in orthopedic as well as pelvic floor rehab. So I work at Ladybird Physical Therapy, and we mostly focus on the pre and postnatal population, specifically returning back to their active lifestyle. We treat really a wide range of conditions, including things like urinary leakage, fecal incontinence, pelvic pain, low back pain, prolapse, as well as diastasis. So that list is not all inclusive. Certainly, they're very common conditions that we see. All right, I'm going to go ahead and get started. Okay. So for today's agenda, first I'm going to talk to you guys a little bit about what is diastasis. So what exactly does it mean, and also what is its relevant anatomy. Then we'll go over the prevalence of this condition, so how common is it, and what are some of the factors that contribute to developing this condition. Then I'll talk to you about the significance of this condition, so why does this matter to you? Then how can PT help? And then I'll demonstrate how to measure diastasis and also teach you an exercise to help address it. Then I'll talk to you about a little special offer we have going on, and then we'll have some time for Q&A. All right. So today's takeaway message, just remember diastasis recti is a common condition and certainly can impact your body in a lot of ways. But a physical therapist can come up with an individualized exercise program to really help minimize the progression of it and reduce the symptoms. So first of all, let's talk about what really is it and what's the relevant anatomy. So diastasis recti, you might have heard it also called DRA. So it's an impairment that's characterized by a midline separation of the rectus abdominis muscle along the linea alba. So just some fancy anatomical words in there. Rectus abdominis is just an abdominal muscle that I'll talk about in a little bit more. And then the linea alba is the fascia in the middle that joins this muscle together. So really, it's generalized weakness of the abdomen. That's really what the condition is. It typically begins during the second trimester. However, it's more frequently starts in the third trimester, just based on the belly expanding the most at that time. And there's some pictures on the right where you can see where the separation can occur. So let's talk about some of the relevant anatomy. So there are 4 layers of abdominal muscles. You have your external and internal obliques, the rectus abdominis, and then the transverse abdominis. So going back to that fancy definition, the rectus abdominis really is just your most superficial, or it's the top layer of your abdominal muscles. Diastasis in Latin means separation. So all it's saying is it's a separation of that specific muscle. The deepest abdominal layer is called the transverse abdominis. We also call it the TA. And that muscle shares fascial connections to the pelvic floor. So that's important because those two muscles really are integral to pelvic floor rehab because they work together. So imagine your core is shaped like a cylinder, and you have the top, that's the diaphragm, the bottom's the pelvic floor, and then the transverse abdominis is the front, but it's also the sides because it's kind of shaped like a corset. And then on the sides, you have the obliques that reinforce. So the other thing that's important, based on the fact that I mentioned the diaphragm is part of the core, breathing is extremely important. And it's important for coordination and function of all of these muscles working together. So here it is. I love this diagram because it's a really simplistic way of showing that cylindrical concept that I just talked about. So you can see at the top, you have the diaphragm, and this is a profile picture. So you have the front over here, the back, diaphragm, the pelvic floor, and then you have that TA muscle, which you can see the fibers also run around. And then you have the deep back muscles. And all of these muscles, they all work together. For the most part, they actually co-contract whenever you're doing deep core exercises. So how common is this condition, and what are some of the factors that contribute to developing it? So here's some stats for you. 100% of pregnant folks will develop a diastasis during pregnancy. And then up to 74% of postpartum folks will have a diastasis immediately after childbirth. And then 6 weeks after childbirth, 50 to 60% will still have a diastasis. So some of the factors that contribute to developing diastasis. So one of the things, if you signed on early, Rebecca and I were talking about this is really becoming a hot topic, is actually being more active during your pregnancy is going to reduce the risk of developing a diastasis. So more and more research is really showing that you might have a wider separation if you don't exercise during pregnancy or don't exercise as much. Performing childcare. So this really has to do with overexerting yourself whenever you're maybe like chasing your kids around, definitely picking up your kids, carrying your kids, doing anything that requires a lot of straining and effort. What happens is it creates a lot of pressure inside your abdomen, and then it contributes to weakness in your core and can exacerbate diastasis. Multiple pregnancies. So this kind of makes sense, right? In terms of that linea alba, or that fascia that joins that muscle together, the more and more it gets stretched, the more it'll lose its integrity to really support that muscle as well as all of the other layers that are beneath it. Maternal age, so this really has to do with biologically, our body's ability loses the ability to regenerate. So these tissues, like the connective tissue and the fascia, will not be able to heal as well as we get older. And then finally, a cesarean birth. So anytime anyone is going to cut into human tissue, the result of that will be scar tissue. So scar tissue is this really tough, kind of non-flexible tissue that sits on top of other tissues. And you can see this is a great picture here, because in this scar, you can see the adherence of the scar tissue. So that's what's causing that skin to kind of fold over. And so if the scar tissue is there, it doesn't allow the muscles to contract and relax as they should, so they can't function as well and strengthen appropriately to help heal the diastasis. So why do you care? Why does this matter to you? So it's associated with a number of symptoms. One is mid-back pain. So you've just given childbirth, now you're having to nurse your baby, you might be in this hunched position quite a bit, you're having to pick up your baby from maybe the ground, or just pick up the carrier from the car. There's a lot of twisting involved, right? That really utilizes the mid-back. And if there's a diastasis there, evidence shows that there's a lot of association to developing mid-back pain. So definitely can be a big interference. And then lots of research out there showing that core weakness can lead to low back pain. So as I've kind of mentioned earlier, with the relationship of diastasis and the core, if there's weakness there, this can lead to low back pain. Aesthetic changes. So coning or doming may occur. You might have heard of these terms before. Really, all that means is the tissue protrudes through where the separation is occurring. And it'll kind of look like a cone or maybe a little bit of a dome. And so this typically will happen whenever you're doing any type of forceful activity. So even like bearing down or even coming up into a seated position from laying down, that will give that shape to occur. And then finally, urinary incontinence and prolapse. So urinary incontinence is urinary leakage. There's been a lot of research, and this has been going on for quite some time, showing that diastasis, which essentially is core weakness, is also associated with leakage. And then finally, prolapse. So prolapse also is definitely categorized as one of those weakness types of conditions. Essentially what it is when organs fall down within the pelvic cavity. And some of the symptoms that are associated with prolapse are heaviness, vaginal heaviness, or dragging, sometimes pain, and plenty of research to show that it's associated with diastasis. All right, so how can physical therapy help? So I found a good research article here showing that a deep core stability exercise program is effective to treat diastasis. So one group underwent a specific deep core stability program with a physical therapist. So they had a one-on-one session with a PT, and the PT made sure that this patient or all these patients did the exercises correctly, engaging the right muscles, making sure they were using their breath, all of that. And they did this program for a duration of 8 weeks, 3 times a week. In the other group, they did a traditional abdominal exercise program. So those exercises were more so the types of things that you might do in like a boot camp. So things like pelvic tilts, reverse sit-ups, trunk twists, or reverse trunk twists. And at the end of it, the result was that the first group, who did the deep core strengthening program, had better results to treat this condition. All right, so physical therapy, what do we do? So one of the main things is education. So education is key because we really want to minimize any anguish or anxiety there might be around this condition. And the goal is really to make sure that the patient understands what this diagnosis means, and also how it's going to impact them. So we'll make sure we go over proper body mechanics on how to manage taking care of your baby so that you're not worsening the symptoms. Also, we'll go over some of the do's and don'ts, and I put in parentheses, this is a very gray area in the sense that it's not an absolute, you can't do any of these exercises or you must do these. It really varies from patient to patient. Hence this whole making sure you have an individualized, customized program comes into play, right? Because we're making sure that we're figuring out and determining where are the muscle imbalances, where are the weaknesses, so that we can give the appropriate exercises. And then also we'll make sure that you know how to check for diastasis so that you can monitor it. Reconnecting with your core, that's a big part of it. So this kind of goes back to that previous slide with the research article. Really teaching the basic fundamental core exercises is really important, especially starting off that way. And then we'll provide you with a gradually progressed exercise program. So once you've kind of learned how to strengthen your deep core, we're also going to make sure that we're customizing this exercise program so that we're maybe starting you off in a very basic position, like lying down on the floor, to then being on your hands and knees, to then a seated position and standing. And then, depending on what kinds of activities you want to return to doing, we'll try to be really specific so that you can return to those higher impact activities as safely as possible. And then finally, manual therapy. So manual therapy, you know, it's not an absolute necessity. However, it can be very helpful to release those restrictions in the connective tissue and the fascia around your abdominal muscles. And so again, it kind of goes back to the concept of scar tissue. If there's scar tissue or if there are restrictions in your fascia that is not allowing your muscles to be mobile and contract and relax as they should, you can see how this would be a big barrier if we give you a strengthening program to be as effective as it could be. All right, so now we have some time for me to demonstrate how to measure a diastasis, and then I'm gonna teach you an exercise to help address it. So you can follow along if you'd like, and then I'll come back and reshare my screen. So I have to stop sharing here so that I can get my camera right. Okay. All right, so I got my mat here. And you're gonna come down onto the floor. And the position to test diastasis is best being on your back with the knees bent, feet flat on the floor. And then I'm gonna go ahead and expose my abdomen here because it's a little bit easier to feel for tissue through the skin. So from here, basically what we're measuring is how wide the separation of the diastasis is, but you can also feel for how deep it is. And you're gonna use your own hands by trying to figure out with the width, how many fingers is the separation. And so the way I like to do it is I put my middle finger just right at my midline. And you can start by kind of finding your belly button and then coming up just below the sternum. And so then from here, I'm just gonna gently press down and I'm gonna come up to a mini crunch where my shoulder blades are coming off. And then I'm feeling for the muscles hugging around my finger. And I can go all the way down towards the pubic bone. So right there, so for me, I have like about 1/4 to 1/2 of a separation there. And so that just shows right there that it's not completely abnormal to have a little tiny bit of a separation. Okay, so now I'm gonna teach you an exercise to help address it. So we're gonna learn how to activate your transverse abdominis. So remember, that's that deep core muscle that is shaped like a corset around you. So the best way to do it is you can try to feel for the muscle being activated. So you'll find your hip bones in the front, and then you're gonna walk your fingers in about 1 inch, and then just gently kind of press down. So this is where that TA muscle is going to contract as I engage it. And you're gonna use your breath. That's all it takes. It's a really subtle type of exercise, and it takes more concentration than like effort. So you're gonna take a nice deep inhale. Exhale, pull the navel to the spine. And what I'm feeling for is underneath my finger, that muscle is contracting and it's firmed up. So it's a little bit firmed up. So basically what I'm doing is a very gentle brace. And then I'm gonna release and everything relaxes. So now the other thing that you can do, and you can do this along with me if you'd like, is recheck your diastasis while you're engaging this muscle. So, and then I'm gonna expose my abdomen, and then I'm gonna activate my TA. So I'm gonna take a deep inhale, exhale, navel to spine. So right there, it's turned on, and I'm gonna keep it on and breathe normally as I keep it engaged. And then I'm gonna come up and recheck. And as I recheck, it's almost closed all the way for me. So there are some changes there. All right. Okay, so I'm going to reshare my screen here. All right. So we're almost done here. So again, just remember that today's takeaway, right, is diastasis recti is it's really common condition, and it can impact your body in a lot of ways, just as I discussed throughout this webinar. And finding a PT and making sure that you have an individualized exercise program can really help to minimize the progression of it, as well as reduce the symptoms. So if you're wondering how to strengthen your core and you felt a gap whenever I showed you how to test for it, or if you're experiencing even leakage, low back pain, or any type of prolapse symptoms, or really any of the common symptoms that I discussed earlier, we are here to help. And to make it as accessible as possible, we are running this special offer for the first 3 of you to reach out to us today. So the special offer is for the first 3 people who reach out to us and have sessions with me will get 20% off of their appointments for the whole month of May. And here's our contact information. So you can call, email, or text us. I've provided both my email address as well as Rebecca's. Rebecca handles the phone consultations, but you can certainly email me with any questions that you may have. And then I've also provided the clinic phone number, our website, and then our handle on Instagram. Okay, so I did see that there were a few questions on here. I'm gonna answer live. Okay, so one question was, how can we deal with scar tissue? So really good question. Scar tissue is, you can manipulate it or massage it really as in a very similar manner as massaging your muscles.
Anissa, do you want to stop the screen share so that we can see you while we're answering questions?
Oh yeah.
Cool.
Okay. So yeah, so scar tissue can be manipulated and mobilized really with some specific techniques that we'll teach you. Sometimes you can use different objects too to help desensitize it. So a lot of times people can be really squeamish with their scar tissue for good reasons. But certainly, you know, being comfortable with feeling it and being able to massage it can definitely be done. Another question was, how can we find where is the diastasis located? Is it up or the middle or down the abdomen? And then what exercises can we give for this? So just as I did in the presentation, you can actually feel it all the way from pretty much below the sternum down to almost down to the pubic bone. So really anywhere along that line. And then I showed you one exercise for it, but certainly there are other ones that we would teach you in your sessions. If I don't have coning during the exercise while pregnant, does this mean I'm engaging my TA properly and that it's okay to continue these exercises? So yeah, so you might have learned how to do a TA activation in the past, or maybe you're engaging it automatically because maybe you're really good with breathing. Again, that's a really important thing, and that automatically really engages that TA. If you don't have coning though, it doesn't necessarily mean that the diastasis isn't there. So certainly, the TA exercise is one way to address it, but as I mentioned, there are other exercises that are very corrective and specific to helping heal that diastasis. Let's see, what are safe exercises during the third trimester? So, for the most part, we're kind of looking at intensity is a big factor. So you want to think about doing things more at the moderate intensity level. It really depends on how active you've been. So if you've been doing CrossFit for a long time, there are certainly ways that you can still continue to do CrossFit even in the third trimester. Versus if you're just somebody who likes to walk around or, maybe even go for running, that's really dependent on what your body can handle and your activity level. So it really ranges. There's not a one answer for that. Hopefully that answers your question. Becky, you may have some other things to say about that.
About exercise in the third trimester?
Mm-hmm.
Yeah, I think for exercise in the third trimester, I agree with what Anissa said. For the most part, you're safe to continue exercise throughout pregnancy that you were doing prior to pregnancy until it starts to feel uncomfortable. So when it comes to running, when it comes to weightlifting, when it comes to anything it is that you're doing, if you start to feel discomfort in the abdomen, heaviness in the pelvis, I always tell people watch out for heaviness, leakage, and pain. And if you're noticing any of those things, and we can even throw discomfort on that list as well, then that's a sign that you want to modify, decrease intensity, but change it in some way. But yeah, I totally agree with you, Anissa.
Yeah. Let's see, other questions. Hopefully I'm not missing any of this because it doesn't look like it's all in order, but there's one about,
I see about 10 questions. How many? I'm trying to answer them as you go through them.
I see 10, but I was just kind of looking at the order of them. But one of them is, do maternity belly bands help with diastasis at all? So yes, I would say that definitely belly bands can be supportive for diastasis, especially after. Sometimes we'll even give exercises, like corrective exercises, and we'll tell you that you can wear your belly band to help support it. My midwife told me to avoid any overhead exercises while pregnant. Is this the case for everyone? So again, it really depends, right? If you are a CrossFitter, that's, maybe a typical exercise is that you might do a lot of weightlifting overhead. And so your body is almost, has a different ability to handle that type of load and strain. So it's not a one size fits all, absolutely. But for the most part, that is a general guideline. Just because if you're reaching overhead, what it's doing is you're kind of stretching and opening that area. And so therefore it can contribute to exacerbating the diastasis.
Yeah, and just to add on to what Anissa said, that's totally true. The reason they tell you not to do overhead activity during pregnancy is because people tend to do extension through their thoracic spine, and that tends to stretch the tissue. That doesn't mean that you can't learn to not do that. So when we work with people, we train them in how to do overhead activity safely. And then if it happens to just not be right for you, then maybe you shouldn't, but it's definitely not like a sweeping, this is unhealthy for all people for all reasons.
Yeah. That's a great addition. Thanks. What can we do pre-pregnancy or during pregnancy for prevention of diastasis? So definitely that TA exercise is like the most basic, most fundamental thing that you can do, which will help prevent the diastasis from being worse. Anything else, Becky, that you want to add to that?
Well, I think for the most part, when it comes to prevention of diastasis during pregnancy, like what the research says, you want to do deep core training and stability workouts. So that's abdominal strengthening, pelvic floor strengthening, working on breath work. A lot of the workouts, a lot of the strength training is going to start with that TA exercise that Anissa taught you. That's kind of like the foundation to everything, and then you build upon that.
Mm-hmm. Yeah. And then just like also, like I said in the presentation, just in general, being active is a preventative thing that you can do. Let's see, I am just on my 6-week post C-section. How soon should I start to work diastasis? And I still am somewhat swollen. Yeah, so you can start really at any point. You can do this, you can do the TA exercise, the corrective exercise, even while you're pregnant and then immediately after. That's actually a really great way of doing something that's safe at that stage. Let's see. Are there any specific Pilates exercises you should avoid during pregnancy to prevent diastasis? So I've done Pilates in the past. I haven't been to a Pilates class in a long time. I know that it engages your abdominal muscles in a lot of different ways. And they are good about teaching transverse abdominis activation. However, there's a lot of like sit-ups and crunches that are involved. So certainly a lot of Pilates exercises can actually contribute to worsening diastasis. So you do want to be careful when it comes to Pilates. Any like addition to that, Becky?
No, the main thing that I want to say that we should have said at the beginning of this presentation is just so that everybody knows this is not medical advice. So if you've heard something from your provider, please remember that we're providing general education. This is not physical therapy. So if you're having any sort of pain, swelling, discomfort, please make sure that you clear whatever you're doing with your provider. You reach out to us for physical therapy consultations.
Mm-hmm. Yeah, that's a great disclaimer, actually. Let's see, can prolapse exist without diastasis? How often is prolapse caused by diastasis, and does it work the other way around? Can prolapse create or exacerbate diastasis? So kind of going back to that slide of some of the symptoms that are associated with diastasis, again, it's an association. So it's not necessarily a cause and effect. They're just usually things that present together. So when we see a patient and they may have a little bit of prolapse symptoms like vaginal heaviness or dragging, they also will likely have a diastasis, but it's not necessarily that one is causing the other. So yes, so prolapse can exist without a diastasis. That does happen. Hopefully that answers that question pretty well. Correction, how soon should I start to worry about it? So again, I really want to try to minimize like the anxiety and the anguish, behind it. There are things that you can do to address it and to make sure that that you're taking the preventative actions in order for it not to worsen later. But you can start these exercises as soon as possible. Let's see. How can we increase the intensity of deep core strengthening exercises for obesity? Okay, let's see. Yeah, so increasing intensity of deep core exercises, there's variations of that. So a lot of it is first, like what Becky was saying, is understanding and how to do the proper activation of the TA is fundamental. And then from there, you can add some leg movements, or you can even add some arm movements in order to make it a little bit more intense. And then progressing to a different position while still engaging the TA can also make it more challenging. Yeah, so another question was, what are some examples of the deep core stability exercises? So I just kind of answered that just now based on like different arm movements and legs.
And if anybody wants more examples of core stability exercises, I've been posting segments from this presentation on our Instagram for the past 30 minutes with a bunch of exercise options as well. So if you want more just variations, if you want to see what these variations look like, feel free to take a look at the Ladybird PT Instagram for those today.
Yeah. And then I have a question here. Do you know if Canadian insurance companies would cover PT services? I'm really not sure about that.
For Ladybird PT, is that what the question is?
Yeah, it says would cover PT services through our clinic, through Ladybird.
Yeah, so no. So Ladybird Physical Therapy is an out-of-network clinic, meaning we don't directly bill insurance. That's true for the United States insurance companies as well as for Canadian and insurance companies throughout throughout the world. We do have different rates for virtual visits if you do want to see us at a distance. So we can talk about what that would look like. But physical therapy is a very restricted field. And so that gets in the way of insurance and also the kind of care that we can provide for people depending on where they are.
Yeah. Let's see, how do we measure diastasis? So I showed you there by lying on your back and kind of using your own hands. Can we see diastasis with pelvic floor issues? So yeah, I mean, for sure, urinary incontinence or urinary leakage or prolapse are considered pelvic floor issues. Certainly there are other things, even for some patients who have like painful intercourse, sometimes there might be a diastasis too that's present, but again, it's not a cause and effect where we're saying because you have a weak core, it's causing this pelvic floor pain or pain in your pelvic floor. Are they both related, diastasis and pelvic floor? So yes, I mean, there's definitely a lot of connections there, just anatomically speaking, as I had mentioned in the presentation. If I still have a diastasis 1 year after pregnancy and haven't started any PT or exercise, is it too late? No, I love that question. It is not too late. Please, we see patients even 3 to 6 to 10, years after they've had their babies, and we absolutely can still help. So please do not be afraid to come. It is never too late.
It's never too late.
Yes. All right. And then does PCOD and miscarriage have something to do with diastasis? Share us about your experience, if any. Yeah, I don't have too much experience with that specifically, just personally. Do you, Becky?
So what causes the diastasis, like Anissa talked about earlier? There are a bunch of risk factors, but for the most part, it's the abdomen stretching and the changes that occur with the tissue during pregnancy and the mechanical changes and the stress on the abdominal wall as the body changes. So miscarriage, PCOD, it really depends how your body has changed throughout the pregnancy, throughout the condition. I don't know of any research specifically on this topic, but I've never heard of those being contributing factors to diastasis recti unless we're talking about a miscarriage later into pregnancy.
Mm-hmm. Plank seems to be such a controversial pregnancy exercise. Yes, it is. Are there situations where you would be safe to do this during pregnancy, or is this something that should always be avoided? So again, this absolutely fits in that do's and don'ts. This is one of those where you might see on the internet, like, absolutely don't do a plank if you have a diastasis. So that is not the case. Because if you, again, depending on what your body's abilities are, you may have a really good activation or good strength of your TA so that when you are performing the plank, it turns on and actually, the diastasis isn't worsened at all. So it's one of those things, like, you could actually do the plank and just actually look down and see if there's doming or coning that's occurring while you're performing the plank. And if there isn't, then, it's safe to do. And yes, it is a big controversial topic. Let's see, if I don't have coning during exercise while pregnant, okay, and then that's another question I already answered. Okay, I think I got all of them. Yeah, I answered these last 2 questions. I guess I didn't click the answer live.
No, that's okay. I've been trying to go through it. Looks like we just got one more. Will Kegels have an impact on diastasis?
Yeah, so definitely it can, just based on how the transverse abdominis muscle connects to the pelvic floor. Again, all these core muscles, they co-contract and they work together. So, it's a lot about coordination and how well you're able to engage these muscles with using your breath and, proper positioning and posture and things like that. And we definitely make sure that you're doing it correctly with one-on-one sessions. Perfect.
Does anyone else have any other questions? One last call. We got a lot. Those 21 questions.
Yeah. I love it.
But it looks like that's it. Looks like those are all the questions that we got. If anybody has questions that pop up over the next however much time, feel free to email me, feel free to email Anissa. You can call or text the number again, that's 512-766-2649. If you want to claim your spot, we have one more for 20% off to be claimed. It looks like we actually just got one more question.
Oh, okay. Let's see. Is a woman who underwent miscarriage on one gravida could perform exercises for diastasis on second? Yes, absolutely.
Yeah, there's never a time that you can't do these exercises. You can do them pre-conception, during pregnancy, as early as 1 to 2 days postpartum. So really, regardless of where you are in your pregnancy journey, in your birth journey, these are always appropriate to do, but they're going to be modified based on where you are. So that's where the benefit of speaking with a physical therapist comes in. It really, everybody's body is different, and knowing what's best for your body is going to be a one-on-one conversation with a professional. Do you have anything else to add, Anissa?
No, I think I'm good.
Great. Well,
I guess actually the only thing would be I'm also on Instagram. My handle is Anissa PT, if you want to just check out some of the posts that I have.
Yeah, and I linked to Anissa in our stories today about this presentation, so you can find her that way too. If anybody has any questions, please feel free to reach out. Thank you so much for joining us. If you have any questions about how we can help you moving forward, you know how to reach us. And we will be sending a recording to everybody who joined today. So thank you all. Have a great day.
Have a good one, guys.